Hello everyone, I am Dr. Nidhi Wadhwa Desai. I'm a women's health physiotherapist. My studio goes by the name of Fit for Life, and my forte is pregnancy and post-delivery fitness and exercise. I also deal with a lot of issues of women's health such as thyroid problems, PCOD, and other hormonal issues, along with a very sensitive and a very difficult problem, which is urinary incontinence, and that's what I'm going to talk about today. Now, urinary incontinence, when you hear it, sounds like a big term, but it is a very common thing that's happening with a lot of women who don't come out and talk about it for simple reason that they feel shy. It's something very personal and they do not want to discuss it unless they're asked by their doctor or by their gynec. So first thing is that what is urinary incontinence? Let's learn about that. So basically, urinary incontinence is that one tends to leak a little amount of urine in form of drops in activities such as sneezing, coughing, laughing out loud, or just simply picking up heavy bags from the floor. So, and besides that, they get a strong urge of emptying the bladder very frequently, and they simply have to rush to the washroom. So these are the signs of urinary incontinence. Now let's learn why urinary incontinence happens. So for that, you need to understand something very basic, that is how the entire thing works. So basically, you have your urinary passage, which is called urethra, in your pelvic floor muscle. So this is a muscle in which there is a passage from where you urinate. Now what happens is that the process of pregnancy, the process of delivery itself, especially vaginal delivery, this along with multiple pregnancies, of people who have multiple pregnancies, these are the people who are prone to developing urinary incontinence. So a pregnant woman, say somewhere in between her pregnancy, might develop urinary incontinence because of the increasing pressure on the pelvic floor muscle. A post-delivery mother may realize that she's suddenly not able to control her urine, or the leakage of urine is happening post-vaginal delivery. Or a mother or a lady who has had multiple pregnancies, say 2 or 3, is more prone to developing this problem. So today, if you maybe when you're watching this video, you might realize that you have this problem, and I would like you to just go in your house, ask a friend or maybe your elder sister or your mother or your grandmother, and I'm sure at least one person will come out and tell you, yes, they have this problem. But you would never know about it because they feel shy about it, they don't talk about it, they don't reach out to the doctor. But trust me, this condition is so much treatable. It is, you can completely get rid of this with the help of exercises if it is worked upon in the early stage. Let's talk about the treatment options that we have for urinary incontinence. You can either reach out to your gynecologist or directly to a women's health physiotherapist who is trained for pelvic floor rehab. Now, the cure typically is of 2 types, invasive and non-invasive. If your urinary incontinence is of a mild kind, there are good enough chances that you will be absolutely alright with the help of non-invasive, that is exercise therapy for pelvic floor muscles. And if at all you need any intervention, then yes, there are invasive procedures, treatments possible in physiotherapy itself, which includes no surgical options, but they are simple tools which are used to treat urinary incontinence. Now, in most cases, we prefer going for non-invasive therapy, which includes pelvic floor muscle exercises. Now, somewhere you might have heard about the term Kegel exercises. Now, what are these Kegel exercises? Everybody talks about them, but very few people really know how it is done. So Kegel exercises typically squeezing of your pelvic floor muscles. Now, apparently this muscle is not visible. It's not like your bicep muscle, which you can hold a dumbbell, squeeze, and you will see the contraction happening, the muscle building up. Unfortunately, You can't see this muscle because it's deep inside your pelvis. It's something that you cannot see, but you can definitely feel and move it. Now, how do you do that? How do you exactly do that? So I'm going to give you a quick demonstration of how you use your pelvic floor muscles in routine and how you can use them to treat your urinary incontinence. So imagine that you have two passages, which is from where you pass urine and from where you pass stool. So the front passage being from where you pass your urine, on your back passage being from where you pass your stool. So what you're supposed to do is squeeze both these passages together, which we normally do when we have a strong urge of going to the washroom, but we can't find a washroom. We squeeze and hold it, right? We don't till the time we can't find a washroom, we hold it. So imagine doing that, but do this without having that pressure, with empty bladder, I would say. So try to squeeze your front passage and back passage together, hold it for 2 seconds and then let it go, and keep on repeating this. You squeeze, you release, you squeeze, release. That is what you are supposed to do to rehabilitate this muscle. I wouldn't suggest that you go about doing it by yourself. You must do it under guidance and supervision, because there are some things that you need to understand in detail, which of course there is a limitation of me explaining to you in this video. So I would suggest that you always seek help for this. Try doing exercises, try rehabilitating your muscles, and believe me, this is a very, very treatable problem. And if you have it, please come out with it, share your problem, and get yourself treated. Thank you so much. So I'm also on the panel of experts on OoWomaniya.com, which is a venture by Kritika. And I and Kritika were discussing that what kind of information should we give out to our viewers, and this is what we came up with, that urinary incontinence is something that is not much talked about. People do not know to whom they should reach out. So yes, this is what we are going to talk about today.